just wanted to tell you guys, we've tried it another way, but we'd like to try that, like normally you guys would do your thing, and then they would arrive, but what's happening is they're missing learning from what you guys do. So what we're going to pretend is you guys arrive early, or for whatever reason you haven't been able to do your thing yet.
Normally,
so you guys will arrive.
Have done
and
this
just
prep.
you guys will say, we're not prepared yet. Are you able to wait? And you guys say, oh sure, go ahead, and you'll be able to observe what they do.
Okay.
So just pretend like you get here.
That they're here first and then we arrive after.
While they're doing their thing after.
Well, that we'll just let play out as it goes. But it just what was happening is you were doing your thing, then they were arriving, and they were missing what you guys did.
Okay.
Yeah. So show up at the beginning before you guys have done anything.
He's
Okay.
on the script, so.
Yeah.
Okay.
Okay.
Are we walking through the door?
We can walk through the door and enter. Yeah.
Okay. You guys already here? Sorry. You guys are here already.
Oh, okay.
Okay. Okay.
Yeah, we'll pretend walk in. Knock on the door.
You're mic'd, by the way. Oh.
Hi, a little bit early.
Oh, that's all right. We're not prepared yet. Are you okay to wait a little bit?
Yeah, I'm Sam.
Hi, I'm Mitchell.
Hi, nice to meet
I'm
you.
Jessica.
Hi, Jessica. Hi, Haley. Mitchell.
Leanne.
Sorry,
Jessica.
Nice to meet you.
Sam.
Leanne.
Jessica.
Sam.
Hi, I'm Jessica.
Sam. Nice to meet you guys.
Okay.
Hmm.
Hi, Mr. Smith.
Okay.
We have some dental hygienists here to see you today. How are you feeling? A little bit sore, yeah. Okay, so we're going to get them to take a look at that. Did you want to get up and okay, yeah. Did you take your medications today?
Medication?
For your pain?
Oh, for my heart.
Yes.
What? Yeah.
Okay, okay, fantastic. Did you need to use the washroom?
Yeah, I think so.
Okay, all right.
My left side is, I have a stroke.
Yes, yeah, that's okay. So we're just going to put your shoes on. We're going to get you into your wheelchair, okay?
He's at the arts too? He was at the arts too?
My mouth really hurts.
It really hurts, eh? Okay, we'll get them to take a look at that.
Just slide your feet over and sit
Okay,
down, Chris.
I'm just going to slide you over to the edge of the bed, all right? All right. How are you feeling?
I'm a bit dizzy.
You a little dizzy? Okay. Do you want to just sit there for a minute? Okay.
Yeah, they're watching, yeah.
All right. Able to scoot yourself forward a little bit? Okay, perfect. All right. You want to hold on to the side of the wheelchair there?
I can lift up with this arm.
Oh, fantastic. I'm just going to grab the gate belt for extra support.
Yeah, that's our head religious suit.
Oh wait, my medication. Did
Oh, you took your medication
Did I
already.
take it?
Yeah.
I? Okay.
He's asking,
Can't
did I take my
forget
pain
my
medication
medication.
already?
Okay, Mr. Smith, we're going to lift you on 3. If you can try to push up. 1, 2, 3. Okay, and Wendy's going to help you sit back into your wheelchair. There you go.
Okay.
Perfect. No, just wait.
I'm gonna go to the bathroom.
Okay, we're going to take you to the bathroom.
Since it's to go to the bathroom. Well, I don't know if he is a willing participant, but we're going into the bathroom.
Okay, Mr. Smith, I'm going to help you onto the toilet here. So if you don't mind putting your hand right here onto this bar.
Oh.
Still a bit sore?
Mm-hmm.
Okay, the dental hygienist will be with you right
Today?
in the toilet. Yep.
Oh, okay.
I'm going to get you in the toilet and then help you on the recliner.
Okay.
If you don't mind putting your arm right here.
Mm-hmm.
Perfect. So I'm going to help you lift up.
Mm-hmm.
And you're going to help me with your right leg and your right arm, and we're going to sit you on the
Oh yeah, I
toilet.
can stand on my right side. I'm okay.
Perfect. Are you ready, Chris?
Just help me a little bit on my left, okay?
Yep. On 3. 1, 2, 3. Okay. Mr. Smith, it's all good. So we'll let you do your business and just give us a yell when you're ready.
Okay.
I was surprised if he like fell on the floor or something. Just ask.
How does Mr. Smith seem today?
He seems okay. He's really sore in his left jaw.
Yep.
And is that the toothache that?
Yes.
Okay.
How long has his tooth been hurting him?
I don't know. He's only been complaining about the last couple days that we've been here, but
Okay.
Have to clarify with him?
yeah.
Okay.
Are you almost ready?
Yeah, I'm all done.
All right, Mr. Smith. We're gonna help you back into your chair. Okay. So can you lift off your bar, and I'll just help you on 3. Already? 1, 2, 3, and switch over. And there you are. Are you comfortable like that?
Back a bit.
Okay. So we're just gonna get you to wash your hands.
Okay. I can do that.
Okay. And can you? There's your cloth if you just want to wash your face too. And if you just want to give your other hand a little wipe too.
Yeah.
Okay.
This one doesn't move.
Yeah.
All set, Mr. Smith?
Do you guys come here every morning?
Thank you.
Every day, yeah.
All right.
how
We're
long
just
have
going
you
to
been
bring you out
helping 'em?
now to see the dental hygienist
About a
because they're
month,
here. Okay.
Oh, really? I got a long time on my
Yeah.
my molar.
Yeah. Not a problem. We'll get you out. There you are.
Hi. We're gonna get you out of your wheelchair and put you in your chair. How's that?
That sounds good.
So these ladies can take a look at your tooth. Okay, you wanna lean forward? And we'll do it on 3, okay? 1, 2, 3.
Oh, and just to let you guys know, he doesn't use toothpaste. He refuses. He only uses baking soda.
Oh, okay.
Use a little bit.
You want your legs?
Have we been notified of the client's name?
All right.
Mr. Smith.
No.
All right, now
first
these
name,
ladies are
just
going to take care
call
of
him
you
by Mr.
now,
Smith.
and we'll
think
just
so.
be here in case you need anything else, okay?
Okay.
Okay.
Thank you.
You're welcome.
There's the controller for that.
Hi, Mr. Smith.
Hi. Can you
Hi.
help us?
I'm a dental hygienist. My name's Sam.
Can you help me? I got a lot of pain on my right side.
On your right side, is it upper, lower,
Lower.
lower side? How long's it been bothering you for?
2 weeks.
About 2 weeks. Is it pretty steady pain, or does it get worse or get better? It's throbbing pain. Okay.
Do you notice is there anything that sets it off? Hot foods, cold foods,
Yeah.
when you brush your teeth, or
Anytime I touch it.
anytime you're touching it? Okay, sounds good. And they notified us also that you're not using toothpaste. You use baking soda when you're getting in there and brushing around too. All you've ever used?
Yeah, it does a trick.
Okay, perfect. Well, we're going to get in there and maybe take a quick peek around if that's okay with you. And we'll see if we can see anything that pops out to us. Okay?
Besides your toothache, how are you feeling today? A little tired, yeah. How are the movements coming?
Stuff.
A little stiff, yeah.
How long ago was your stroke?
6 months ago.
6 months.
Are there any other dental activities that you have a hard time doing, like when you're brushing or flossing or anything like that since your stroke?
I have dentures in the top,
Yep.
and they didn't really tell me how to take care of them. I don't know, sometimes they smell a little bit. I don't know how to clean them properly, maybe.
We can help you with that today as well.
Yeah.
We can give you a few tips on how to take care of the dentures. Are they fitting well still? Yeah, they feel okay?
Yeah.
Okay.
And how are you managing for like saliva? Do you find that you have a dry mouth a lot of the time?
Yeah.
Yeah,
Lately a lot.
lately a lot. And are you on certain medications since your stroke by chance?
I'm on a blood thinner.
Okay.
Yeah, with prevention of stroke.
Okay. That's good. we'll have to look into maybe your medications, see if they're maybe contributing towards the dry mouth, or there's also some other options we can try to look into to see if they're contributing to that also.
Yeah.
Okay.
Okay.
Try to take a look in the mouth.
So,
Let's
yeah.
take a look. So we're just going to put on a mask and glove quickly, if that's okay with you, Mr. Smith. Okay, we'll just be a second. Can I put this on and talk with the mask and the microphone? Yeah.
How's your movement in your right hand today? Is it progressing? Is it getting, your right arm's okay? And is there anything in your left at all, or is it just pretty stationed there for a while? You can feel? Okay, no movement? Okay.
So for your home care, are your PSWs brushing your mouth for you, or are you responsible for caring for your denture? Okay. Are you finding you're okay to brush? Is it hard? You brush twice a day, once a day? Okay. And are you removing your denture at all? At night or anytime? Okay. 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 So when you do take it out, what kind of storage are you using? Are you just leaving it on your counter or just put it on the table? Okay. So we'll teach you all of this after Beth takes a look inside to see what's going on, okay?
Do one of you girls maybe mind just rolling up my sleeves?
Sure. Let me see. How's that?
Perfect.
Is that one okay?
Yeah. Okay, Mr. Smith. So my name's Jessica. I'm just going to take a quick peek around inside. Okay, so you're saying it's your right side, down on your lower side there, the big tooth right at the back there. Perfect. You got some gum in there, chewing some gum. Do you mind if we just spit it out just for a second there while I'm taking a peek around? Perfect. Let me fix my mask. It's caught on the microphone. Okay. Perfect. So like you said, it kind of hurts even with pressure, hot or cold, both hot and cold.
It's swelled up down there too.
Yeah, very swelled up. And for how long have you been noticing this?
About 2 weeks.
About 2 weeks now, eh? Okay. And now it's just kind of getting to the point where it's very irritating anything that you do?
Anything where I put pressure on it, with like down it, it really hurts.
Okay, perfect. Well, when I'm just looking around in here, there could be some suspicion for certain areas, so we'd like to refer you to a dentist just so he could take a look at it and try to confirm exactly what's going on in there. And I think he could really help you with the management of the pain down in that area, if you're okay with that.
Yeah, that'd be really good.
Okay, perfect. Okay, Mr. Smith, I'm just going to wash up quickly over here.
So I'm just going to sit beside you here and ask you a couple questions. Is that okay? So how long have you had your dentures for?
8 years.
About 8 years? Yeah. And has the cleaning of the dentures just been worse after your stroke, or have you always had a little trouble with them?
Since the stroke.
Since the stroke mainly? Okay. So I'm going to show you just a few little ways on how to care for your denture. Are you okay sitting here? I can just show you. I'm going to sit up a little bit. Sure. I'll just get... Yep. That feels okay? Okay. Now, where have you been cleaning your dentures? Or in the bathroom?
But not every day.
Not every day. Okay. Are you able to come to the bathroom sink with the wheelchair? Would you like me to give you a demonstration here? Here's okay for you? Okay. So what's good to have is a towel. You want to line the sink down or wherever you're cleaning your dentures. If it's a hard surface, you want to line the towel underneath, just in case you drop it. With the one hand that's being able to move right now, it might be a little more difficult. So what you can do also is you can set the denture on the towel. You can have water beside you. There's also, I'm just going to get you to grip this brush and see how you do with that. You can hold it pretty well? That was fine? Okay. So right now you're leaving your dentures just on the side of the bed, out in the air all night? Okay. Now, dentures are best if they're left in a moist environment just because they fit well when they're in your mouth and your mouth is moist. So at night when you take them out, you also want to leave them in a dish with maybe some warm water. You can get polishing denture cleaner, but you don't want anything too abrasive. You just want it neutral in there, let it sit. And when you take it out in the morning, you can rinse it under water before you place it back in your mouth. So you can get little baggies. And that's just how it sits in there. So when you take it out every morning, you'll want to take one out at a time. Now it might be a little difficult just because, are you able to hold anything with your left hand? Or it's pretty stationed, eh? Okay. What you can do is you can leave it on the towel. You can try and brush around it. You want to be careful if you ever grab these metal clasps. They're just kind of what holds and shapes the tooth. They'll keep your denture in place. You don't want to bend them. Try not to. And you want to just brush gently around everything. Try and get in the crevices. Again, if it's on the counter and you're not holding it, you can just do it very gently. You can run it under water. That can also get debris off of it. It's easy with one hand to use. This as well, same idea. This one might even be a little easier for you to clean. It's not floppy, but it's not as, it's sturdy on the table, more sturdy. So you can even just brush inside, turn it, you can brush on the other inside, and then you flip it around, and you want to just go on the sides as well, on the inside, and all on the chewing surfaces. Just make sure it's clean, get the food out. And right now you're brushing your teeth with baking soda, toothbrush, and you only have a few teeth on the bottom, right? Is that right? Okay. Has your mobility in your arm and your body coming back slowly? Or is it, how you been feeling?
So much on this side.
Not that side?
This side's been okay.
That one's been okay?
Mm-hmm.
Okay. And how often are you brushing your teeth that are in your mouth right now?
I try to every day.
Mm-hmm. At least a day, once a day, or just?
Sometimes I forget though.
Yes. Okay. Just a little bit of general knowledge for you. Sometimes there are artery clogging plaques that you can develop in your mouth. Not saying it's directly linked to heart disease or strokes or anything, but if you're the plaque is sitting and it's not being removed on your teeth, it can go into your bloodstream, and sometimes it can increase your chance to have another stroke. So it's very important to try and remove the debris that's in your mouth right now, and keep up with the work on the dentures. If you lie on the towel and you just brush around off as much as you can. Okay. Did you want to try?
Yeah, sure.
Sure. So I'll give you the towel. Let's just see how you do with it.
Very good.
Yep, that looks really good. You're using your thumb as leverage so you can hold it down. That's perfect. We can also have a little glass of water with the mild solution. Hand soap even works on dentures so it doesn't scratch. Yeah. They can handle that. Now do you want to try this one? Thank you. That one will be a little more difficult, but it's a good idea. You're doing good. Great. Do you feel pretty comfortable with that?
Yeah, that's
Yeah,
not too bad.
not too bad.
I didn't know I could do that. I thought I just put it in water and that was it.
Yeah, no, it's good to brush off the debris.
Yeah.
Some of the food gets stuck in there still, even though it's not your normal
Yeah.
tooth structure. It can still get caught.
Okay.
So you feel comfortable?
Mm-hmm.
Yeah.
That's a lot better.
Okay, that's good. Good, good. Also, I know your hands are okay, your right hand anyway. This sometimes can be easier as well. This is just a regular toothbrush, but you can also put it on the denture brush and your regular toothbrush. Sometimes it's easier to hold and to grip.
Mm-hmm.
That feels good?
It does feel better.
Yeah. Just something to show you. Yeah. Yeah.
Hi, Mr. Smith. My name's Haley. I'm also a dental hygienist. So I'm also going to talk to you about some different aids you can use for cleaning your mouth. Are you brushing the areas that you are missing teeth?
Yeah, I just go, all the way across.
Okay, because it's important to also brush your palate and brush your edentulous areas. You have some teeth on the bottom, so I just want to show you a good technique to remove dental plaque. I know you only brush maybe once a day. It's good to brush twice a day, especially if you're going to brush once a day, brush at night. So that's another thing to look for.
Okay.
Way to brush would be starting at the gum line and more rolling the stroke up. This is kind of the general technique we teach to all of our patients. Okay, and then on the insides it would be like this. And then once again, this toothbrush is adaptable for your hand if you have a hard time gripping the toothbrush or anything like that. As well, the PSWs, if you're ever going to do home care for him, if he can't get to the sink that day, you can have a kidney basin with toothpaste and toothbrush. I know you're saying you're using the baking soda. However, if you have the dental decay in your molar, it would be a good idea to use a fluoridated toothpaste just so you can help remineralize those areas that are demineralizing, and especially if you're not brushing twice a day to remove that plaque. Well, if it's based on sensitivity from recession or dental tubules, you can use Sensodyne or Colgate Pro Argin to stop the sensitivity. But if you have a higher risk of cavities, we would suggest something such as Prevident or even fluoride trays that we could make for you or something like that. But just said that you get referred to the dentist and the dentist would confirm if it's a cavity or not, okay? So just the baking soda is just a little bit abrasive, and a fluoride would help with that cavity and preventing more cavities as well, okay? So kind of that. Are you flossing at all in the area that you have teeth?
It's too hard for me to floss.
It's too hard for you to floss?
I can't put it between the two fingers.
Okay.
Yeah.
So I'll take one of the PSWs after, and I'll show them how to floss your bottom teeth, okay? Would you like that?
Yeah.
Okay, good, because that's good as well to prevent cavities from forming in between your teeth, okay? Did you want to show me a technique of brushing in your mouth, or how do you feel about that today? Yeah? Okay, I have this mirror for you. And this is just another denture brush that Sam didn't show you. It has a bigger handle and then a smaller brush to get inside the clasps for the lower denture. But
That's power as well, so you just kind of push the button and set it on your
if you're
teeth
having
and
a
it...
hard time brushing, then just let the brush do all the work for you. Okay. So, is there any way to get some water? Can I get a small glass of water? I'm just gonna rinse this as well.
You guys help brush dentures too sometimes and brushing.
Yeah.
Yeah, that's good. Good, good. Mm.
So this is a brand new toothbrush just for you. So I guess I could hold that mirror for you if you want.
Did you think?
Yes. So you just want to
So-
go on the bottom teeth.
Alright, whenever I try to go,
Start at the
I go up like that to get
Okay.
stuff out,
okay.
and then I go back. I can't brush back there because it's in pain.
It's so sore.
Mhm.
Okay. Well, when that gets fixed, then you would also just do the rolling. kind
Okay.
of.
And then for the rest, I just go back on the horse, and that's
Okay.
it.
Okay. So, like we said before, you just put your hand. I just want to touch your hand. You can grab the toothbrush as well.
Yep.
So you put it in your mouth,
Mhm.
and you just kind of do like a flicking
Oh, like that all the way back?
Yeah,
Okay.
even in the background as well. You just don't want to cause too much damage to the gingiva and cause it to recess.
Oh,
Which,
okay.
if it starts to recess, that could also be why you have sensitivity as well, right? So, do you feel like you could do that technique? Seems pretty easy.
Yeah. I never did that before.
It's just a better way of cleaning. That's all it
More
is.
there.
Yeah, that's sensitive.
Yeah.
Okay.
Yeah.
Okay. Good idea. All right. Well, I think Jess is just going to finish up with talking to you about your dry mouth, and I'll take one of the PSWs to learn about flossing, okay?
Okay.
So nice to meet you.
Thank you.
You're welcome. Take your toothbrush.
Okay, Mr. Smith, I'm just going to talk to you about a few things that could be contributing to your dry mouth. So, you were saying is there any medications that you've been put on since your stroke again, sorry?
Blood thinning.
The blood thinners. Okay, and also, are there certain foods that you find you have a hard time eating or anything like that?
Anything
Do you want one?
bread, cereal.
Breads, just have a hard time getting them down, eh? Yeah, okay. So a couple different techniques that could help you get those down or whatnot. Just try to avoid, obviously, the crunchy breads. They might be hard, or if you're consuming those, maybe try to dip them in like some sauces or gravies to soften them up. Can help them slide down a little easier. Try to avoid also the acidity or the really spicy foods. They can be kind of irritating to the oral to your cheeks and everything inside your mouth. So yeah, so that could definitely be contributing to a bit of your dry mouth symptoms. So try to kind of avoid those foods. When you're having your meals and that, always try to have kind of a non-high sugar drink. So anything like water, just to help get those get the food down as you're drinking or eating, sorry. And also, I noticed that you had gum with you. That's a great idea too. If you're always having gum, look for gum too. It's an ingredient called xylitol. So it kind of attacks, it's the Streptococcus mutans, which is the bacteria that causes cavities. So we try to have our gum that has xylitol in it, like after we're eating or anything like that, for 5 minutes, around 2 pieces. And then, so we're incorporating that into our diet also, and that's helping attack those bacteria that could be contributing to the pain that's in the back of your mouth as well. And it's also stimulating your saliva glands. That way, it's producing some saliva, helping you get that food down and helping your mouth just get more moisture in there in general. Yeah, so did you have any other questions or anything like that that you'd like us to answer for you, or?
Sounds good. I just really want to get to the dentist and get this fixed.
Yeah, understandable completely. And we can make a referral out for you today, and we can get you to see somebody as soon as possible. That way he could help you out in that situation, okay? So did you have any other questions in general for us today, or did we seem to cover a lot of your questions, or?
So if I start brushing the way you told me though, it'll be better. I'm not going to have any more pain
just-
like this.
I can't guarantee you're not going to have any more pain, but it's definitely going to be a good contribution to eliminating that pain and not having it come back again. Incorporating just cleaning your denture and keeping up with your general good oral health is definitely going to eliminate the chances of getting cavities or anything like that. So it's great to keep up with your oral health. And like Sam was saying, just to eliminate all of that plaque also helps decrease your chance of possibly getting another stroke as well. So.
Can you tell my PSWs to get me some of that toothpaste that you're talking about?
Yes, we will definitely with that. And for your dry mouth also, there are a couple things that we could look into. It's a toothpaste called Biotine. There's a mouth rinse also, and it's meant for dry mouth as well. So it's to help produce saliva and stuff like that as well. So keep up with, like I said, lots of water, non-sugary drinks, because the sugar drinks, when you don't have very much saliva in your mouth, your saliva also kind of helps. It's a neutralizer in your mouth that helps neutralize the pH levels in your mouth. So when you don't have very much saliva in your mouth, you can also be getting the bacteria that can lead towards cavities as well. So when we're having lots of water and stuff like that also, it helps decrease our chances for that. So lots of water, gum, avoid the crunchy foods, or if you're going to have them with sauces or something like that, and try to stay away from those acidic and spicy foods. I know you like your Tabasco sauce, but yeah, so do you have any other questions?
No, I think that's it.
Perfect.
Good, thank you.
Yeah. Yeah.
It was nice
Hi.
meeting you.
Yeah, it was very nice meeting you.
Nice meeting you.
Bye. Thank you very
Bye.
much.
Thank you.
Are we back?
Okay, folks, that's a wrap.
Hey.